All right, so plastic surgery these days more popular than ever with new technology making procedures faster, safer, and a lot less scary.
1 in 5 women in South Korea, in fact, has had cosmetic work done, making the country the leader in global rankings for the number of surgeries conducted.
But the thing is that permanently altering your appearance is not for everyone, hence the market for non-invasive to minimally invasive procedures. And to help us understand the various procedures that don't require going under the knife is Dr. Yvonne Goh. She has a clinic here in Singapore, Dr. Yvonne Goh Aesthetics. Good morning, doctor. Thank you very much for joining us today.
Good morning.
Good morning, Dr. Goh. All right, let's clear this up. Non-invasive procedure. It still must be minimally invasive when you do something to somebody's face. What exactly would non-invasive be?
So there's a difference between non-invasive and minimally invasive. For non-invasive, it means that the skin is left totally intact. There's no injection, there's no peeling, literally non-invasive. So non-invasive treatments would include things like IPL, skin rejuvenation and tightening techniques using things like laser, radiofrequency, ultrasound, and then CoolSculpting, which is a fat freezing treatment for fat reduction, microdermabrasion. So these are all examples of treatments where you walk out with your skin totally intact. There's no needle mark, no redness, no swelling.
So most people would have a high tolerance for these treatments.
Yeah.
Very little downtime. Very
little downtime. So it's really just suitable for almost everyone.
So, but these non-invasive procedures you just mentioned, they do react under the skin.
Yes, the treatment happens under the skin. So it bypasses the skin layer and it treats from underneath.
How effective is it?
It's quite, considering there's no surgery, no needle, I think it's pretty effective, considering the factors involved with the treatment. Of course, there are limitations because it's non-invasive. So the general guideline is the more invasive it is, the more significant the results. So that being said, there's a nice scale of non-invasive, nice, gradual, natural results.
So for a non-invasive thing, it's not a one-time procedure.
There are some. So with all the innovation and technology going on right now, they've managed to do more significant treatments, one-time treatments that are long-lasting. For example, if you do CoolSculpting or therapy, they're both non-invasive, but you're good for a year or so for our therapy. And then CoolSculpting, once you remove the fats, is forever.
So what's CoolSculpting then? You literally freeze the fat and it disappears?
Yeah, they kill the fat cells under the cold temperature, and your body metabolizes it and passes it out by itself.
So we have some pictures on the screen right now, before and after pictures. So that is what CoolSculpting does. You target an area and you reduce the area that you want to remove the fat.
Yeah, spot treatment for fat reduction.
Okay.
Something very interesting. All right.
Yeah.
and it's not painful at all?
Well, there can be some discomfort depending on the individual. Most people tolerate it very well. The more fat you have, the less sensation. For people who are slimmer, who just want to contour a little bit of fat, they might feel it a little bit more, but generally very well tolerated.
Okay, yeah. Let's talk about Botox. Very popular around the world and in Singapore as well. That would be considered minimally invasive.
Yes.
How effective is it?
It's very effective. In worldwide treatments for wrinkles, nothing can tackle wrinkles like Botox does.
But we've seen instances when people have their wrinkles removed and their foreheads don't move.
Yeah.
Is that normal, or is that a badly done Botox, or is it over Botox?
Yeah, so a lot of it is operator dependent, the dose that doctor uses and the method, and also what the patient wants. It can be all titrated, so if people want natural movement, it can be done in such a way that we dampen down the movement, but we keep expression.
Okay, so we have some pictures there right now. I think the lady who is frowning looks a bit more obvious. Yeah? How would you explain how the Botox is applied in these cases?
So she has a very strong glabellar line, which is the
line here,
frown between the brows. So what we do is we administer the Botox into that muscle that's causing the furrowing. And over time, that would take effect in about a week or two. That will relax that muscle. So we find that the muscle cannot frown as strong as it used to be, as it's used to. So for example, now the after photo is her trying to frown, but she can't because the muscle has been relaxed.
So this doesn't last forever. It lasts maybe a few months.
Yeah, so usually 4 to 6 months.
Okay.
Okay, but Botox, more than just taking away lines, can be used for other treatments as well.
Yeah, they also have therapeutic uses. So back in the days before Botox was used for cosmetic, for 20 years before that, it's been used for all these pain relief, neck pain, scoliosis.
Pain relief and neck pain.
Because a lot of pain is due to muscle related. So if you relax the muscle, you can get pain relief. For example, a lot of people have this clenching problem called temporomandibular joint dysfunction, where they clench, and it causes a lot of headaches and like wear and tear of the joint, of the jaw joint. If you Botox that muscle, you can get relaxation and you can curb the clenching and then preserve the jaw joint.
Okay, so doctor, moving away from Botox and fillers and all these procedures, let's talk about the marketing these days. A lot of clever marketing going on, especially online. People are very easily swayed by the promise of good results. What should people be on the lookout for so that they know they're getting the right information?
Okay, well, firstly, if they see something medical related, always ask their physician what their opinion is about this article. And then if they're going to read stuff online, perhaps stick to well-recognized international news portal, for example. Things like BBC, New York Times and subsidiaries, Straits Times.
Or Channel NewsAsia. Yeah,
and Channel NewsAsia. All reliable sources. And then if they're going to read like other magazines and publications, make sure that it's a very well-known, well-established publication.
Okay.
Yeah.
So, but when you have a patient who comes to you, and we're talking about invasive and minimally invasive procedures here, do they want to go to you to change the way they look, or do they just want to turn back the hands of time or improve certain parts of their faces?
So we have a lot of different demands. So people sometimes come asking to alter their features, enhance their features, and some people just come for anti-aging reasons, right, to preserve youth. And a lot of people do it for prevention or acne scar, acne treatment. Back in the days, to enhance features is usually a surgical job, plastic surgery. But with all this innovation and technology for aesthetics industry right now, you can actually alter features with minimally invasive techniques. That's why it's becoming revolutionary. With fillers and Botox alone, and a bit of like facial sculpting, skin lifting treatments, you can actually optimize how the features and proportions look in your face. So like, for example, fillers can now be used to like alter your nose, your chin, your brow, your forehead curvature. You can alter the proportions of all your features just by filler injections.
Okay, so what do you and I need?
Oh, you guys look great. Showing nothing.
Just saying that. Thank you very much, Doctor, for sharing that with us.
And that was Dr. Yvonne Goh, Medical Director of Dr. Yvonne Goh Aesthetics. Some tips if you're looking to spruce up your look a little.
I'm going to think about that. All right, we're going to take a quick break here on First Look Asia. When we return on a brand new hour.